We're recording. Well, welcome back to the Sleep Edit. I am Craig Canapari.
And I'm Arielle Greenleaf.
So today we're going to cover the two big M's in sleep. Yeah. So that would be melatonin and magnesium, two of the supplements that are a lot of parents are interested in for their kids' sleep issues or themselves. A lot of people seem to be using. I can tell you it's unusual for a parent to come to sleep clinic without having tried melatonin. A lot of pediatricians recommend it, but a lot of parents just try it as well. But in the last couple of years, I've seen more and more parents having tried magnesium or magnesium supplementation or are asking me about it as well. So I guess we thought it'd be interesting to group these two things together.
Absolutely.
Ariel, what are you hearing about this stuff?
I feel like the majority of my clients don't share that they've tried these things. I have to imagine, given being a member of many moms groups on Facebook and seeing what I see, I have to imagine that a lot of my clients or potential clients have tried whatever they can to help their baby or child sleep. Hopefully we're not looking at giving melatonin to babies or magnesium to babies, although I did see recently, how do I get my, under 1-year-old or something to sleep? Can I use something like melatonin or magnesium? And I was just blown away to see that. And I will say also that when parents are asking for help in these groups, almost always the first response is melatonin. And lately it's been magnesium. And mostly I'm seeing magnesium in a lotion or cream that people are claiming works wonders.
Oh, yeah, we're going to get into that. As a provider, this is one of those things I just always ask now because people might feel weird about it, especially if their pediatrician didn't ask them to do it. And yeah, you get some weird stuff. Be like, how do I get my 4-month-old to chew this gummy? It's always best to ask in a
Yes.
non-judgmental way, which I know that you do. But I know the providers listen to this, and I think it's valuable information. Like I'll say, what have you tried? What medications have you tried? What supplements have you tried? I'd say if you're putting something in your kid's body, think about it like medication. I wouldn't differentiate between a natural supplement, which is what a lot of people consider these things to be, and a prescription medication.
Yeah.
There may actually be some more issues with these types of things than with prescription medications.
Just because it's natural and organic doesn't mean that it's necessarily A, helpful, or B, safe.
I mean, I don't know about you. My kid's got an ear infection. That better be some free-range penicillin they're getting.
Yeah.
Organic or a locally sourced amoxicillin.
Homemade.
Yeah, homemade. So let's start with melatonin because I still feel like melatonin is like the 800-pound gorilla here.
Yeah. So why don't you tell us, what exactly is melatonin?
So melatonin is a hormone that is secreted in the pineal gland of your brain, which is the little tiny structure at the center of your brain. And some people call it the hormone of darkness. And the reason being is that your body starts to secrete melatonin about an hour before your usual sleep time. Before then, it's undetectable in the bloodstream. When you can detect that rise in melatonin, that's called the dim light melatonin onset. That is the signal to your brain and the tissues in your body that it is time to wind down for the day. Those melatonin secretions will stay relatively high in the bloodstream until about an hour after you wake up, if you go to bed and wake up at the same time every day. One thing a lot of parents don't know is melatonin is a hormone, right? So it's kind of funny that you can just go down to the store and buy your kid a hormone for their insomnia. So imagine if your kid was like having a hard time in Little League and you're like, I'm getting my kid these testosterone gummies and I'm going to see how he does, right? That's not the thing that we do.
No.
We're not like, oh, my 13-year-old hasn't had her period. Why don't I get some estrogen gummies and start giving them? But for reasons we're going to talk about, melatonin is considered in the US at least to be a food supplement and not a medication. It used to be sourced actually from pig brains. Now it is synthesized in laboratories, which is better. So, yeah, that's maybe less organic, but probably better. So melatonin, if you take it, the technical term is exogenously. If you take it like a medication, first of all, the amount of melatonin in your bloodstream is much higher than your body naturally secretes. And there are really two notable effects when you take melatonin. The first is the hypnotic or sleep inducing effect. So, this is what people are generally trying to do when they take melatonin because they have insomnia or they're giving it to their child for insomnia. They're giving them a dose of melatonin. We'll get into dosing later on with the goal of helping to induce sleep. The important thing to note is that not everybody gets this hypnotic effect. And the way this will manifest is I have parents coming in and they're giving their kids these horrendous doses of melatonin. Think like 10, 20 milligrams. And they're like, it's not working. And he's waking up more at night with nightmares and is sleepy during the day, which are all side effects if the dose is too high. It just doesn't work in everybody. The other effect, which does occur in everybody, and this is going to get a little bit more into the weeds of sleep physiology, is what's called a chronobiotic effect. So if you have someone whose circadian clock is out of sync with the schedule they want to have, in my world, that's usually a teenager, where their natural sleep schedule is much later than they would like, giving a tiny dose of melatonin, think 0.25 to zero point 0.5 milligrams, about 5 or 6 hours before they're falling asleep can start moving their sleep schedule earlier. This is not what most parents are trying to do, but honestly, this is one of the more common reasons we are using melatonin in the sleep clinic. So the
Why?
dosing for that is different and the timing is different as well.
Yeah, what is that? Can you explain that timing? I know we're
So,
not talking about teenagers much in this podcast, but it is interesting to understand the timing.
so when we think about, and actually I can link to a video that sort of demonstrates this graphically, but um, in when you want to think about moving someone's schedule, if you want to move their sleep schedule earlier or later, melatonin will pull the sleep schedule towards it. So if you give melatonin in the evening, it'll make someone over 3 or 4 weeks fall asleep earlier, and light will push it away. So light will make them stay up later. And the opposite is true in the morning. So if you are trying to get someone to sleep later, which is generally not something I'm worried about a lot in sleep clinic, but in, say, elderly who may have advancement of the circadian phase, meaning they're falling asleep earlier than they were like falling asleep at 6 o'clock and getting up at 3 in the morning, a tiny dose of melatonin after they wake up can help move it, will pull it towards it. So it'll move the sleep schedule later, and light in the morning will move the sleep schedule earlier. It's pushing it away. And the magnitude of that effect, and again, we're really getting the weeds here, it's what's called a phase response curve. If you give melatonin at bedtime, you're not going to get much of an effect on the body clock scheduling, which is actually not what we want in little kids. We're not trying to move their schedule earlier or later too much. But in somebody else, if you want to get the maximal effect of moving your body clock earlier, you want to do it 5 or 6 hours before they're falling asleep.
Very interesting.
Circadian medicine is very cool and kind of confusing for trainees. So we talk
Can you
about it a lot.
share a little bit about how so a lot of times I see my child falls asleep easily, or I'm giving them melatonin because they don't fall asleep easily and they wake multiple times a night. Can you talk to me about the efficacy of night wakings and melatonin?
Sure. Well, most of the studies of melatonin are showing the primary effect is shortening what we call sleep onset latency. And that's the time from when you turn off the lights to when you actually fall asleep. Now, in children with autism, there is some evidence that it might reduce night wakings. The problem is, and this is, again, don't think of melatonin as a natural supplement. Think of it as a medication. The problem with any medication for sleep is it's pretty easy to help someone fall asleep. It's harder to get them to stay asleep, to miss night awakenings. And the hardest thing of all is to get them to sleep later in the morning, especially children. And the reason is just how your body processes medicine. If you take any medicine, typically you're going to get the highest amount of it in your bloodstream within an hour of taking it, and that's going to fall off over time. We use a term called the half-life. A half-life of a medication is the time when half of it is essentially gone from your body. If it's got a longer half-life, it's going to last longer in the body. If it's got a short half-life, it's not going to last as long. And melatonin has a relatively short half-life. So again, like any medication, it's tricky to dose things to try to get kids to stay asleep. And actually, if the dose is too high, you can make night wakings worse.
Well, I mean, I feel like it's counterintuitive. You would think, oh, okay, we want this to have a longer effect. Let's give more of it. But what I've heard is that in many cases, a smaller dosage is better, lower dosage. And I've actually seen this reported in mom groups. It's like, it's helped my child fall asleep. It is not helping them not wake in the middle of the night. They're still waking in the middle of the night. What do I do? And then they're like, do I give melatonin again in the middle of the night? That's a little scary too.
Yeah, I mean, I think what we are seeing, and I know you know this, but for the audience, is that like any of these, be it a prescription medication, a supplement, if you are having sleep problems, you really want to pair this with a behavioral intervention, because these medicines, they're not magic, they're not anesthesia. It's not like flipping a switch and you're guaranteeing 10 hours of sleep. For the majority of children, not all of them, but a lot of them who are having sleep problems, there's at least a behavioral component to that. If you don't change your behavior, if you don't teach your child to fall asleep independently, if you are letting them have screens in their room, if their schedule is different from what their body needs, no amount of medication is really going to help. And, I think a lot of the times people are using these things because they don't want to, it's easy to give your child a gummy. It's harder to make behavior change.
Absolutely.
And really, our goal for any of these tools, like supplements, medications, whatever, is to use them as long as you need them and to not use them anymore. There are some of my patients who take melatonin for long term, and there are some that we are able to get them off it in the short to medium term because they've learned how to fall asleep independently.
So the question then is, I see it so frequently used, or parents saying, oh, you have to try it. I feel like it's like almost the first response these days. So when is it appropriate to use melatonin with a child? Are there age considerations, dosages, specific medical conditions that it would be helpful for?
So I want to get into some of the conditions that are best studied for melatonin. But first of all, I would say recognizing that melatonin is a hormone that you're giving your child to help them fall asleep, you should tell your child's pediatrician to it. They don't necessarily know a lot about melatonin, but they do know a lot about sleep and behavior in children. That's what pediatricians are expert at. So first of all, I'd say, if you're thinking about trying it, talk to your child's pediatrician. I will say, in most of the world, melatonin is prescription only. That's true for much of the EU. In Taiwan, it's classified as a controlled substance, actually. So it's not marketed to parents or filling up the whole. I feel like there's the purple aisle now in the pharmacy.
100%.
It's melatonin and sleep gummies and what have you. There's clear evidence for, I'd say the most evidence is for kids with autism, that it's pretty effective for helping with falling asleep and staying asleep. And a recent study actually showed that it helps with daytime behaviors as well. There is some evidence for chronic insomnia in children, though most of that is in older children, not little kids, not like 0 to 3. Think more 6 to 15. ADHD, there's evidence. The body clock disorder we talked about, delayed sleep phase syndrome, or circadian disorder, there's evidence. And actually there's some studies in conditions like blindness, like eczema, where it does seem to help as well. I would say that there's less evidence for normally developing children who just need a little bit of help moving towards independent sleep. It doesn't mean that, again, lack of evidence doesn't mean it might not be helpful in an individual child. But that's why it's so important when you're using something like this, is to also be like, hey, say to your pediatrician, hey, I'm struggling with my child's sleep. I'm thinking of trying melatonin. Anything else I should try with this? Or could anything else be causing this? Like I mentioned eczema, because eczema causes terrible sleep disruption. And the solution to it is not melatonin. The solution is treating the eczema.
Sure.
So there are many childhood conditions which can cause disrupted sleep.
Seek out the root cause before you just go to the purple aisle. And they are. It is. It's all purple. It is shocking to me because there is a whole section aimed at children. And I just think it's wild that it's just so accessible. And it's a
Yeah,
hormone. You know, like you said, it's a hormone. It's a synthetic hormone. And I mean, natural, like you said, is it really natural? Is it, I mean, it's made in a lab. Is that what makes it organic?
yeah.
Like you said,
It's
free
a
range, free range
it's big money is
hormones.
the problem. Yeah. The well, we can talk about when we talk about overdose and stuff like that.
Yeah.
I would say that when I would avoid melatonin is I use it maybe sparingly in kids under 3. I'm an expert. I wouldn't recommend parents do that without guidance from a specialist. Jody Mandel has this great quote that is melatonin is like hormone replacement therapy for sleep, right? Like so, you know, if you're in menopause, you probably don't just get a menopause gummy, right? You probably get hormone replacement therapy. I just want to hammer this away because
Yeah.
it's just got to the drugstore.
Right.
I got to the gas station.
Next time I'm at the gas station.
Yeah. I'd say the other thing is if you're not willing to make changes to behavior, again, any sleep medication, it's not anesthesia, it's not magic. At best, these things nudge things in the right direction. They're not going to cure the problem.
Would you recommend it for jet lag or like an overnight flight or something like that for a child?
There is some evidence that melatonin can help with jet lag, with sleep onset. It's tricky though, because it depends on when you dose it, depends on the time zone, the direction of travel, how far you're traveling.
Yeah.
There are even apps that'll help you figure this out. I'm a little bit less worried about people who are using melatonin once in a while.
Okay.
Like, I'm going to be honest and full disclosure here. My older son, he's 17. If he feels really revved up at night, he may have a melatonin. He has it maybe once a week. That doesn't concern me, right? Like, he's a young adult who's like, I know I'm going to struggle to sleep tonight because I'm worried about school. He's generally an excellent sleeper. I'm not that worried about that. And I'm not that worried about parents who, after talking to their pediatrician, they use it once in a while if they're traveling or if there's something stressful going on. So that's one of the themes we'll kind of close with, is that using something once in a while is less worrisome than using it all the time.
Right. When do you think it would be like long-term use? I'm just thinking of parents that I see that are like, oh yeah, we've used it since Johnny was 4 and he's 10. Thoughts on thoughts on long-term use in a neurotypical child?
Well, there aren't really a lot of long-term studies of neurotypical children. The longest studies we have at melatonin are mostly in kids with autism, and the longest we're looking at is 2 years. The biggest concern with melatonin, because it's a hormone, is could it have an effect on puberty? Could puberty happen early or late? Based on these 2-year studies, that does not seem to be the case.
Yeah. I mean, can you become dependent on a gummy?
So you don't seem to get biologic dependence like you do with, like, say, I know people aren't using opiates for this, but like you develop a biological
We
dependence.
hope not.
It doesn't seem to, if you take melatonin for a long time, it doesn't seem to stop your body from making your own melatonin.
Okay.
But there is psychological dependence, right? Like I've had patients who are like, they're just worried if they miss their gummy, but they really don't need it. And often we'll kind of cut it in half. We've even had parents substitute in some regular gummies, just like candy. And the kids seem to be fine. Not that I generally advocate deceiving kids, but like I think that was in like a special situation. There's an obstetrician and gynecologist named David Kennaway in Australia who's very against this practice in kids. And he talks about, he has this quote, parents should always be informed that 1, melatonin is not registered for use in children. This is in Australia. 2, no rigorous long-term safety studies have been conducted by children. And 3, by the way, melatonin is also a registered veterinary drug used to alter the reproduction of sheep and goats, which is true. Humans don't, we're not, I'm blanking on the term, but we don't go into heat once a season, which sheep and goats do. So like it's a little bit of It's not an entirely fair comparison, but makes you think, right? A little bit.
Yeah, absolutely.
So I do want to talk a little bit about the dosing of melatonin because
Yeah.
there are some guidelines about this. Generally, the max dose anyone should be using, and this is from a European consensus statement, which is the best thing we have. For kids under 40 kilos, that's 88 pounds, the max dose should be 3 milligrams. So that's a pretty big kid, right? That's a 90-pound kid. Above 90 pounds, 5 milligrams. In our clinic, we start at half a milligram and we go up by half a milligram to a milligram once a week. And we stop at either when the issue is better or when they hit the max dose. And there's two reasons for that. First of all, as you said, a lot of people actually do better with less melatonin than more. The other thing is it gives a chance for the behavioral effects to take effect, right? Like if you start to make some behavioral changes, maybe for our kids, a lot of the patients we're seeing, they're too young to have an ADHD or an autism diagnosis, but they may be headed that way. So a little bit of melatonin often can help the behavioral changes take root.
What
Sorry.
age range are we looking at there?
I'd say I still try for 3 and up, sometimes younger though. But again, I'm an expert. I work with a sleep behaviorist in my clinic. We are screening kids for medical issues. I'd say for parents and pediatricians, generally less than 3, I'd really think twice.
Yeah.
Again, there's not a lot written on this, but I just sort of feel like you have to be cautious, right? Little kids have a longer time to develop. We don't know what the effect of adding hormones is to a developing brain.
Right.
The other thing is timing, is that a lot of people give melatonin. A lot of kids actually do better. And the studies of chronic insomnia and melatonin, we're looking at giving melatonin about an hour and a half or 2 hours before bedtime.
Interesting.
So parents have to fiddle with this a little bit. Some will say it has to be 30 minutes before bedtime or it doesn't help. But others will say, oh, it works better. Got a 7:30 bedtime. It works better if I give it at like dinner.
Yeah.
And then later on, it kicks in. Side effects, important to know about with anything. Nightmares are common, or vivid dreams, especially if the dose is too high. Also, nighttime awakenings. That's why we'll see people coming in. They're giving their 3-year-old like 10 milligrams of melatonin. Oh. These kids are waking up in the middle of the night. They're having horrible dreams. Because the amount you're getting in the bloodstream is so high, you can also get what we call, technical term is residual daytime sleepiness or sleep inertia. Think of it like a hangover from the medication. Bedwetting can happen. And there is a real overdose risk.
Natural.
It is natural, but a couple of things. It is now the most common accidental ingestion in children 5 and under. Because it is regulated by the FDA as a food supplement, it is not required that there be a child-proof lid on your melatonin bottle. So there's this problem, I think, in medicine. I think of the gummification of medicine. Like, no kid is dying to drink a bunch of amoxicillin.
No.
Something that is packaged as candy, looks like candy, comes in a fun purple bottle. There's a risk there of your child getting into it. A study that came about from the CDC in, I believe it was 2022, showed that there had been a 530% increase in calls to poison control centers over melatonin, with a marked uptick during the pandemic when kids were sleeping poorly. And actually, there were some ICU stays and even a few deaths reported on this. And because this is, we don't really think of melatonin as something you can easily overdose on. So I don't know anything about those other kids, those few kids that died. I know that they were young from this data. We don't know if they had other medical conditions. We don't know what the magnitude of the overdose was, but it's not zero, right? Like your kid could end up in the emergency room in the hospital.
Right.
The other group of kids that are overdosing this are on teenagers who are making suicidal attempts or gestures. They may take it with other medications. So again, like all medication, whether or not it's a supplement, parents have control of it. Keep it someplace safe. Do not let your kid have access to it.
Mm-hmm. I did see that CDC study a few years ago, and I was just blown away.
A couple other issues I want to highlight with melatonin, specifically in the United States. Because this is regulated as a food supplement, it is not subject to the same level of scrutiny that, like, say, a generic form of ibuprofen would be. There was one study looking at over-the-counter melatonin prescriptions and found that compared with the dose on the label, the actual dose that was in the medication was between -83 to 478% of the labeled dose.
Oh my Lord.
So, like, if you were
Oh,
giving your kid a 1 milligram gummy, they might be getting a 0.25 milligram gummy. They might be getting a 5 milligram gummy. This is another reason to start low and go slowly and increasing your dose, because we really, it's poor quality. In the UK, they have some wonderful preparations that we know work. There's some that come on quickly that are very, it's a pharmaceutical there. We have long acting metforms that seem to work well in autism. The long acting forms in the US really don't seem to be that helpful
effective.
because we don't know anything about the delivery system. It's not tested like a pharmaceutical.
As a physician, are there specific brands that you would recommend?
I'm a little reluctant to get into that.
Yeah, I agree.
Anything.
Yeah.
I mean, you can look for like NSP certification. That's a third-party certifying program. If there's third-party certification, it's a little bit better. Your drugstore brands are actually usually pretty good.
Okay.
Another issue for parents to be aware of, and this is true, we'll get into magnesium as well. Parents will come in the office, they have no idea how much melatonin they're giving their kids. Because I'll always ask if parents say, I tried melatonin, I don't know why it didn't work. My first question is, what was the dose and what time did you give it? And parents will say, oh, I gave them 3 milliliters, or I gave them a gummy. Well, you could get a 0.5 milligram gummy. You could get a 10 milligram gummy. 3 milliliters of what? So I'd say to parents, look on the label, look at the number of milligrams. That's the number that you need to know.
Yeah.
Companies that are responsible tend to have the melatonin gummies we get for my kid. Again, I'm not going to endorse anybody. 2 gummies is like 2 milligrams, right?
Okay.
It's 1 milligram per gummy. Honestly, I take a little melatonin at night. It helps me fall asleep. I take a 0.5 milligram. It's great. There are like 20 milligram gummies out there. It's nuts. So these things, yeah, it's crazy. So those are the things I wanted to share about melatonin. But what other questions do you have or other thoughts you have based on what you've seen?
I feel like anytime I see melatonin as like first course of action, it makes me cringe. It's so much easier to say, give a gummy than to change habits and enforce habits, because children don't like to do that. They like to take a piece of candy, but they don't necessarily like the way you're doing the bedtime routine or what time it's going to happen or how you're addressing any middle of the night wakings. If you change that, if perhaps they are used to you coming into their room and sleeping in their room or bringing them into bed, the family's struggling here, take a whatever dose of melatonin. So those are my only thoughts. I don't feel like I think people are sometimes ashamed, and so they aren't forthright about saying, yeah, I've been using melatonin with my 4-year-old. Sometimes they are, but in many cases, I feel like they probably did try it and it didn't work well. So the more you can educate, the more we can talk about it, the better, because I just want parents to be informed about what they're putting in their child's body, rather than just, grabbing something off the shelf.
Well, and I would say to anyone listening to this, if you're giving your kid melatonin, you don't have to freak out, right? Generally, we have found that for people that are taking it, as far as we can tell, seems to be reasonably safe. That being said, ask yourself, does your child really still need it? Are there other changes you can make to make them less dependent on it? Are there issues that you might not be addressing that you're addressing with this, like anxiety or something like that? So again, if you're listening to this, don't freak out, but maybe ask your pediatrician about it. Make sure that they know. And, even for our kids that we have taking melatonin long-term, we often will do, what's called a drug holiday. So usually over like summer break or something like that, if they're in school where the stakes are kind of low, we'll say, stop it for a couple of days, see what happens. And a lot of parents are pleasantly surprised that it doesn't really matter once they stop it. Or if their kid was falling asleep at 7:30 on their melatonin and they take away the melatonin, they're going to bed at 1 in the morning. And I have patients like this. You can feel pretty good about the fact that your child actually needs it. They're deriving a real benefit from it, right? If you stop it and they're like a little bit more annoying and whining at bedtime, but then in a couple of days, it's back to what it was, then you know what? Save the money. This stuff isn't cheap.
Right. I think maybe the answer is more have a conversation with your pediatrician. It's not necessarily don't freak out, don't panic, but, have a discussion with your pediatrician so that everyone's on board, dosage is being looked at, and things like that.
Yeah, absolutely. Well, shall we move on to the new kid on the block?
Absolutely.
The new hotness, magnesium.
Magnesium.
I always like to look in Google Trends and sort of see when things are getting popular.
Yeah.
And this really started to uptick in early 2022
Interesting.
in terms of searches for magnesium for sleep. I could not figure out what kicked this off.
COVID?
Sort of like gradually increasing compared to melatonin and theanine, which we're not going to get into today, but another supplement that's commonly marketed for sleep. Magnesium, in the last couple of years, there's quite a bit of interest in it. I see that reflected in what people ask me about. I take a little magnesium glycinate for me. I sleep better. I'm going to do an article on the supplements that I take for sleep and my Oura Ring data with and without it to show you the diligence that I've done. But, I'm not sure what's driving this, other than the fact that people are stressed and not sleeping well.
I mean, I think you had a good point about, the overdoses of melatonin, and that study coming out in 2022, which we were still sort of in the COVID era there. I think children did struggle a lot with sleep. Parents struggled with sleep. Everybody struggled with sleep over COVID. And I think what I see sometimes too now is what supplements can I give my kids that aren't melatonin to help them sleep? I also feel as though marketing people who are creating new products picked up on the fact that parents were starting to feel a little uneasy about melatonin. As much as I still see it, I'm starting to see more of a trend of what else can I give my kid? And I would say in the past couple of years is when I've seen this uptick in magnesium. Now, like you said for yourself, I actually discovered magnesium glycinate when Ashley was like 10 months old, and my acupuncturist recommended it for milk supply, actually, because she was getting older and I was working. And I remember I took it and I had the best night of sleep I'd had since I'd had her. And I texted her in the morning. I said, is this supposed to help sleep too? And she said, yes. Did you sleep well? And I said, yes. So I have taken it sporadically over the last 10 years. It has worked. I feel like it's worked well. Perhaps it's, in my head, but I'm so interested in, talking about what you've found out in your research.
This is one of those things I meant to look at for a while, and then I started looking and it kept becoming more and more complicated. Because I don't, honestly, it's most of the time the people think about magnesium are either endocrinologists or renal specialists, kidney specialists in my world. So it's magnesium, it is number 12 on the periodic table for the chemistry nerds in the audience. Usually when you're taking it, you're getting the cation of it, sort of the positive ion for it. And magnesium is actually involved in 80% of the enzymatic functioning in the body. So it's a hugely important mineral for the way that we function. Clearly, if someone waved their magic wand and hoovered all of the magnesium out of your body, you would be dead. If someone took away all your melatonin, you wouldn't sleep that night.
Yeah,
So,
that
like,
would not be good.
in the hierarchy of stuff, it's kind of important, right? And it has a lot to do with the effects of muscle relaxation. There's an interesting table that I put in my article on this that is sort of looking at the overlap in symptoms between magnesium deficiency and the symptoms of stress. So, top symptoms of magnesium deficiency: tiredness, irritability, anxiety, muscle weakness. Top reported symptoms of stress: fatigue, irritability, feeling nervous, lack of energy.
Sounds like being a 43-year-old woman.
Yeah, it sounds like being a citizen of America. Specifically in the realm of sleep, it does a couple of things that are interesting. It stimulates GABA receptors. GABA is a neurotransmitter that's associated with relaxation and sleep. it is actually important in the production and release of melatonin from the pineal gland. So it may actually be a little bit upstream of melatonin release. And it mediates the stress response. So if you have less magnesium than you need, you're going to feel more stressed. Interesting stuff, right? Like in
Yeah.
a lot of people with anxiety or stress struggle to sleep. So I thought that was actually a compelling relationship to look at. Especially, we found that magnesium deficiency is actually thought to be incredibly common in the population at large. And I was really surprised by this. Let me jump ahead and say it's actually very difficult to diagnose magnesium deficiency per se. And the reason is because it is so important in your body, the level of magnesium you have in your blood, if we do a blood test to measure your magnesium, it is almost always going to be normal for two reasons. First of all, the vast majority of your magnesium is in your bones, in your muscles, in your brain tissue. So it's not moving in and out of the bloodstream. And second of all, because it's so important, it's really closely regulated in the body. The way that they've looked at magnesium deficiency in the population is they look at intake of dietary studies of what are people are logging what they're eating. And a lot of people, like something like 70-80% of people, are not getting enough magnesium in the diet. And there's some two interesting reasons for this. I mean, first of all, is that people don't have particularly healthy diets. So processed food has a lot less magnesium than, say, eating a bunch of spinach, right? Versus Reese's peanut butter cup. Also, if you're drinking soda, it reduces magnesium absorption.
Soda?
Soda, I think soda specifically, what I saw.
Okay.
Maybe it's all the seltzer you're drinking. I don't know. In the last 100 years, the amount of magnesium, calcium, and phosphorus in produce has gone on down substantially because of the way that we farm. There's a lot less magnesium in the food supply than there used to be, which is fascinating and a little bit concerning too, right?
Yeah,
Like
sure. Yeah.
but I think we're in a world where we have a lot of stressed people. A lot of people in my world, they can't sleep. Their children can't sleep. And a lot of reasons why people might not have as much magnesium in their bodies as they would to function as well as they want it, right? So like it seems like a setup for a good idea. That taking magnesium might be a great idea. So here's the problem. There are probably around 20 studies looking at magnesium supplementation for sleep in adults. About 7 or 8 of these studies were fairly compelling. They were in elderly people, and they showed that magnesium helped with sleep onset latency, which is time to fall asleep, nighttime awakenings, and total time sleeping. There was one study from 2002 where they actually gave elderly adults magnesium, and they had more slow wave sleep. Ask me how many studies of magnesium in kids have been performed.
How many studies of magnesium in kids have been performed?
One that was in infants in the NICU, and this was really giving them as part of their food, and it showed that they had more quiet sleep, which is the analogous thing to slow wave sleep versus active sleep. It was like 15 infants. There have been studies that looked at this indirectly, specifically kids with ADHD or autism, where magnesium has helped with daytime functioning, but those authors didn't look at sleep. So it's hard to recommend magnesium in children where we don't have any evidence that really helps with sleep. So we have a situation which I would say has biological plausibility, right? A lot of people don't have enough magnesium, and that likely includes children as well. That low magnesium can be associated with sleep problems, and having enough magnesium helps with sleep, but we haven't made that final step to say giving magnesium seems to help with sleep. Whereas in melatonin, we actually have a lot of studies that it actually helps with sleep, right?
Yeah.
So like, it's not that it couldn't help, and it does potentially help in some kids. We'll talk about who might be more likely to benefit, but it's hard to recommend it when we don't have any evidence.
It's interesting that the studies that you found to be viable were all in elderly. Because I feel like people my age and your age, young people, talk about using magnesium glycinate and other things like that to help them with sleep. So I'm wondering where if it's popular right now or becoming popular in the pediatric world and parents of a certain age. Why is it, is it just that they, it's not worth studying, or, what was the lack of scientific?
Well, here we get into the problem of pharmaceutical trials. First of all, in the world of pediatrics, it is very common for drugs to be tested in adults versus kids.
Of
The
course.
adult market's a lot
Yeah.
bigger. Most children don't need any medications, right? Like most children are healthy or they take one medication. A lot of elderly adults are taking a ton of drugs,
Yeah.
right? And they have a lot more health problems.
Yeah.
The other problem is, how do you make money on it, right? So a well-powered pharmaceutical trial costs hundreds of millions of
Yeah.
dollars. For something that is already available at low cost, who's going to pay for that study?
Right.
Maybe I'd say before, January 20th, NIH, I don't know. But there's not a lot of wood behind the arrow with this. But it's very common for us to use, because I'm a specialist, I deal with kids with complicated medical problems who don't have easy solutions. We're often using drugs where we call them being off-label. They don't have pediatric evidence, but we need to do something.
Yeah.
I think the main problem is the financial one.
Okay.
Going back to melatonin, these wonderful preparations they have in the UK to help with autism, for that to get approved by the FDA as a pharmaceutical would literally require an act of Congress to say that melatonin is a pharmaceutical. It is no longer a supplement. And
Over the counter.
It seems
Yeah.
pretty unlikely right now.
Right.
So it's not going to be for sale here because there's no money in it.
Yeah.
Right. That being said, there are some conditions in kids which are clearly associated with low magnesium. And if I saw a patient with these issues, I might actually be more likely to consider magnesium because I know that these kids are more likely to have low magnesium. Again, highlighting the fact that it's actually difficult to measure magnesium without using radio tracer studies where you're measuring it in the muscle and the bone. Blood tests aren't particularly useful. Those conditions are type 1 diabetes and celiac, or kids on a gluten-free diet. First of all, parents, if your kid doesn't have celiac, don't put them on a gluten-free diet because it has downstream effects, which is a thing that I see that happens. Actually, obesity, common, maybe associated with low magnesium, and picky eaters. And when I think of picky eaters, I often think of my patients with autism who have very restricted diets.
Sensory issue type diets, like they don't want to eat specific things.
I had one young man I cared for who literally ate flurries and French fries from McDonald's.
Sounds good.
So yeah, it's delicious. But you don't want to have the whole basis of your diet be this.
Yeah.
And that was a real hardship for his family.
Sure.
I think that I would definitely, if someone with type 1 diabetes or is a picky eater was having difficulty, I might consider a magnesium supplement in those patients. And here's the thing about magnesium is if you take too much of it, you're just going to pee it out. You eliminate it through your kidneys. So as long as you don't have kidney disease, it's a little bit hard to overdose on it. I could not find any poison control data about magnesium overdose like we have with melatonin. Doesn't mean it's not there, but it doesn't seem to be as big a problem. The other thing is that there's only one case report of a child that died from excess magnesium. And this was a child with cerebral palsy. The parents were doing all these mega doses of vitamin. A typical magnesium glycinate, like you might take, might have 90 milligrams of magnesium. So you'd have to go out of your way to do that. That being said, for most parents, and most parents are like, oh, I would like my kid to have more magnesium, see if it helps with their issues. I would say, make some dietary changes. I'll actually post in the show notes. The NIH has a wonderful worksheet and also in an article I wrote on this with high magnesium foods. I'd say beans, green leafy vegetables. And guess what the number one magnesium containing food is?
No idea.
It's pumpkin seeds.
Oh, of course.
Pumpkin seeds. So seeds and nuts actually have a lot of these trace minerals. So if you could, again, in little kids, you don't want to give them nuts because there's a choking hazard.
Yeah.
You could try nut butters, like almond butter, something like that. In older kids who are old enough to safely chew this stuff, pumpkin seeds or nuts may be helpful. So I'd say for most parents, making dietary changes is going to have some other downstream benefits. In terms of magnesium supplements, actually, when I was writing this, again, the NIH came through because they have this wonderful sheet by age on what the max dose via supplementation should be.
Awesome.
So for parents, I would say that, first of all, I would try dietary changes first. Second of all, I'd say that this is not magic, right? We don't know if this helps or not. Dietary changes likely have more benefits, but if you're really struggling with this, you could try this. But I would ask that with any change that you make, again, also make behavioral changes and track your child's sleep and see if it actually helps. Because the fact is, these things cost money and a lot of these supplements are quite expensive. And I sort of feel like there's a lot of chicanery out there. When I was looking at the number of magnesium and sleep gummies on Amazon, I was a little bit shocked, honestly, at how many products are marketed there. And they usually don't just have, it's not just magnesium. It's like a little chamomile, a little this, a little that, like it's all, how do you know if any of that stuff is even in there? Unless you have like a mass spectrometer in your house, you have no idea what's actually in that stuff.
Yeah.
So Arielle, let's talk about your favorite topic, the thing you recommend to all your clients.
I send it to them. Didn't you know? As soon as they...
Our new company, Magnesium Lotions and Sprays.com.
Right. Well,
I don't see this, so I want to hear from you what you're seeing out there.
Yeah.
In the streets.
Out in the streets. Like I said, I feel like a lot of parents are saying, what can I do aside from melatonin? And so what I'm seeing, and some people are, they don't want to give a gummy or something like that. So I see lots of people talking about lotions and creams. And I even saw someone who said she makes her own magnesium lotion. I'm trying to figure out how that is even a thing and how do you make it? Do you crush up the magnesium and put it in lotion? Here's someone, we tried a roller recently.
A roller? Like a lint roller?
Like probably like a, almost like a perfume roller or Yeah. I used so I'm looking at what I've seen. I used magnesium lotion and spray. I bought the magnesium spray from X and use it on my son's feet every night.
Stuff is wild.
Yeah. There's a whole someone swears by the lotion on the feet. I find magnesium cream on my toddler's feet really helps. So I'm really curious about, how does it really help?
So I looked into this. There's no studies to support this practice. And again, I feel like I'm punching down a little bit here, but this is obviously BS, right? So I think there's 3 issues here. First of all, there's little to no evidence that magnesium helps anyway. Again, we talked about the fact that it might help some people. This is not an evidence-based practice at this time. Second of all, the way you absorb magnesium is through the gut, not the skin. So imagine if you're oh, I need more sodium and chloride in my body. I'm going to go for a swim. Does your body get filled up with salt when you go in the ocean? No, because your skin is impermeable to ions. Magnesium, sodium, chloride, it cannot pass through your skin. Your skin is a barrier, right? So there's no way it's actually getting into the body. Interestingly, in my research, I did come across a trial looking at Epsom salt baths which do increase magnesium. The way that they do that is probably being absorbed through the anus and rectum. So this is not a practice I would recommend in a child for the simple reason is that how much dose are they getting? I don't know. Or if you put a cream or a lotion on your kid, how do you know that they're not eating it? Right? And then what's the dose? Right? My friend's dog just had to have her leg cut off and they're she has to wear the cone because she's got a fentanyl patch on because they don't want her to eat it. Right? If your child has a medication has what's purportedly a medicine in it, they might eat it. Right? Yeah. I don't know. I guess you can put footy pajamas on, but guys, save your money. This is just again, the placebo effect does work, right? Sometimes doing something is better than doing nothing, and it gives you a sense of power. But like this stuff is not cheap.
Right.
And this is the sort of thing that makes me angry. When I look on Google, like the top 8 search results for magnesium sleep in kids are like lotions. It's bananas.
Marketing preying on tired parents, and they know that they're going towards parents who want natural remedies and perhaps trying to stay away from melatonin, or the market of children who are too young for melatonin. So let's try this. It's just, there's such a huge market out there for things that are going to help a normally developing child sleep, when in actuality, they really don't.
I mean, let's be real. The reason these things exist is because this is a hard problem. If your child won't sleep, you're stressed, life is difficult, right? Parents don't have supports like they did a couple of generations ago. That being said, parents, you've got a certain amount of money and a certain amount of time. Spend it on things that actually have evidence for them. What pediatricians do know a lot about is kids and how to help kids. And I think that's, again, don't think about these natural supplements or tools as having no side effects, because the fact is, there's nothing that works that has no side effects, right? Like, if you want to think about it as being as powerful as a medicine, you have to think about it having side effects as well. We see what, I don't know, readers my age will remember Fen, right? The weight loss supplement that was very popular in the 90s.
Yeah.
Everybody's taking it. They were losing weight like crazy. It was great. But then a lot of people were getting cardiomyopathy and dying.
Yeah.
So that came off the market. And the melatonin and magnesium is going to kill your kid. But honestly, you got to think about everything you're doing. Just because it's natural or a supplement, subject it to the same amount of scrutiny that you would anything else.
Yeah, and just because it's on the store shelves doesn't mean it's necessarily safe or effective.
Or they have a beautiful website, or there's a great Instagram account. Again, I bought stuff on Instagram. I'm not perfect. Marketing works, right?
Yeah.
So listen, I think we're kind of at the end here, but there's a couple of things I wanted to highlight, which is, if you're considering magnesium or melatonin, talk to your pediatrician. If you're trying these things, start low and slowly increase the dose over time. Generally, and I'm talking kids 3 and up. For gummy medications specifically, keep them someplace safe. And gummies are a choking hazard. Really, for a gummy, I'd say like a 5 or 6 year old at the youngest, right? They should take it under supervision. Some nights are a little bit better than every night, right? Like in terms of reducing your perception that you need it. Any supplement you use, make some behavior changes to go with it. This is your opportunity. And with melatonin, remember the dose timing matters. You got to fiddle around with it. Sometimes a little bit earlier evening will be more helpful. We've got a lot of great stuff we're going to put in the show notes on this. Think of YouTube for this too. I have a lot of graphics I can put up, which might be helpful for people. And I'll link to that video on how the timing of melatonin matters. So that's what I've got. Arielle, what you got?
I'm just really glad we dug into this, or I should say you dug into this, because, again, there's so much misinformation out there. So as long as we are sharing the truth and evidence and educating people, I'm feeling really good about that. And hopefully we can at least reach a few people so that they don't waste their money.
Honestly, again, if you tried these things, parents, you haven't harmed your kids, but just be careful out there. There's a lot of evidence-based treatments for sleep problems. It's probably worth more, worth thinking about. What's our email again? Because I can never remember it.
thesleepeditshow@gmail.com.
Are you sure?
Yes.
Okay.
Now you're making me second guess.
That's our email address forever.
Yeah.
Okay, guys. Well, thanks for listening. And if you find this useful, share it with your friends.
Thanks so much.
Bye-bye.